Health check. Turning age 50. Are you at risk for these 12 medical conditions? Hello to all my subscribers and anyone new to this channel. I am Dr. Parker, and please continue to watch this video to hear from Fit and Wellness Over 50 about 12 medical tests that every 50-year-old needs to know. When you turn 50, there are a few medical tests that you should consider getting. Even if you're feeling healthy and don't have any specific symptoms, it's a good idea to get tested. These tests can help you catch any potential health problems early on, which gives you a better chance of treating them successfully. So, if you're approaching your 50th birthday, talk to your doctor about what test might be right for you. You'll be thankful you did. We will discuss some of the most important medical tests to get when you turn 50, such as cancer, mammogram, colonoscopy, and others. Cancer is the second leading cause of death in the United States, and about 1 in every 4 deaths are caused by cancer. Cancer is a group of diseases that can be caused by many things, including genetics, lifestyle choices, and environmental factors. There are many types of cancer, but some of the most common includes breast, colon, lung, and skin cancer. There are many different risk factors for each type of cancer. Some of the most common include smoking, obesity, exposure to certain chemicals and radiation, and a family history of the disease. Cancer test guidelines vary depending on your individual risk factors. But in general, here are some of the cancer screenings you should consider starting at age 50. Mammogram. This X-ray exam can detect breast cancers when they're too small to feel and are most treatable. The American Cancer Society recommends that women aged 50 to 74 get a mammogram every 2 years. If you have a higher risk of breast cancer, you may need to be screened more often. Pap test or HPV test. These tests can detect precancerous cells in the cervix, which can be treated before they turn into cancer. The American Cancer Society recommends that women aged 21 to 65 get a Pap test at least every 3 years. Women aged 30 to 65 can choose to get an HPV test every 5 years instead of a Pap test. Colonoscopy. Now, this exam allows your doctor to look for precancerous polyps in the colon and rectum. The American Cancer Society recommends that people average risk of colorectal cancer start colon cancer screening at age 50. People with certain risk factors, such as a family history of colorectal cancer, may need to be screened earlier or more often. Bladder cancer screening. For people at high risk of bladder cancer, your doctor may recommend a yearly urine test to look for blood or other signs of this disease. People with certain risk factors, such as smokers, may need to be tested more often. Prostate cancer screening. Men are at risk of developing prostate cancer, which is most treatable when caught early. The American Cancer Society recommends that men aged 50 to 74 talk to their doctor about whether they should be screened for prostate cancer. These are just a few of the many cancerous medical tests you should consider getting when you turn 50. Talk to your doctor about which tests are right for you and when you should have them. And remember, early detection is key to successful treatment, so don't put off these important screenings. We will now discuss certain tests for heart health, such as cholesterol, EKG, and others. The most critical tests for heart health are cholesterol tests, an electrocardiogram, and a stress test. A cholesterol test measures the amount of bad cholesterol and good cholesterol in your blood. An EKG is a test that measures the electrical activity of your heart and can detect problems with your heart rhythm. A stress test involves walking on a treadmill or riding a stationary bike when hooked up to an EKG machine. Now, this test helps determine how well your heart functions during physical activity. If you have any risk factors for heart disease, such as high blood pressure, diabetes, or a family history of heart disease, your doctor may recommend additional tests such as a coronary angiogram. This test uses X-rays and dyes to take pictures of your coronary arteries and check for blockages. Vision test. One of the most important senses that we rely on day to day is our sense of sight. As we age, it is not uncommon for our vision to deteriorate, so it's essential to get regular vision tests. If you wear glasses or contact lenses, you must get an eye test every year to ensure your prescription is up to date. You can usually get this done at your local optometrist. The same goes for hearing. Hearing loss is a common problem as we age and can have a significant impact on our quality of life. That's why it's essential to get a hearing test every few years, especially if you notice any changes in your hearing. Now, these tests can usually be done by your GP or at a specialist clinic. Blood pressure test. The first medical test you should get when you turn 50 is a blood pressure test. This is because high blood pressure can lead to heart disease, stroke, and other health problems. A blood pressure test will help your doctor determine if your blood pressure is in healthy range. If your blood pressure is high, your doctor may recommend lifestyle changes or medication to help lower it. These changes can include eating healthier, exercising, and quit smoking. Bone density scan. As we age, we lose bone mass. A bone density scan is a test that measures how much calcium and other minerals are in your bones. It can be used to diagnose osteoporosis, which is a condition that causes bones to become thin and weak. Now, this test is painless and takes about 15 minutes. Diabetes screening. Diabetes is a common disease, and most people don't know they have it until they are diagnosed. If you have diabetes, your body doesn't make enough insulin or can't use insulin properly. Too much sugar in your blood can lead to serious health problems, including heart disease, stroke, kidney disease, blindness, and amputation. There are two main types of diabetes screening, the A1C test. The A1C test measures your average blood sugar level over the past 3 months. And the fasting plasma glucose FPG test. The FPG test measures your blood sugar level after you have fasted for at least 8 hours. Conclusion, turning 50 is a major milestone, and it's important to make sure you're doing everything you can to stay healthy. Make an appointment with your doctor to discuss the medical tests that you should get done this year. Knowing what to expect can help you stay on top of your health and detect any potential problems early on. And if you find this video to be informative, please give us a thumbs up and click the subscribe button so you can be notified weekly of more informative videos. Thank you for watching, and please share your stories.